Hello there, this is Dr. Mintz. This is a 38-year-old male who was shot with a rifle in the chest. Shot from in front. And I'm going to give you a chance to kind of get an overall view of what's going on here. Here we have soft tissue windows. Okay, this is a rather striking image here, showing the trajectory of the bullet through the left upper lobe and fragments along the side of the spine there. Okay, going down you see a lot of fluid, pleural fluid. What kind of fluid do you suppose that is? It's blood, pure and simple. Little fragments hanging down here. What space are they likely in? The pleural space. That's how they have escaped from the trajectory, and they're not lodged in the lung, but have entered the pleural space where they could just kind of fall into the dependent part that is otherwise filled with blood. Okay, so that's a soft tissue window. And I think it's always a good idea when you look at cases like this to get the big picture first, not get too focused on findings in the specific area of interest. And now go to the lung windows. Always important in trauma. Why? You're looking for pneumothorax. In this case, he has a very tiny pneumothorax there. A little tiny one there. Now remember, pneumothorax, when large, is clinically very significant. Any kind of pneumothorax is potentially very significant because it means that there's either a hole in the lung or a hole in the chest wall, or both. So even if it is small, it can get larger and still has the potential, even if it gets larger, to produce tension pneumothorax. So always very important to identify even a tiny pneumothorax, even if they're smaller than what you're seeing here. If we saw just something that small, for example, still very significant. Okay, so here we are looking at the lung windows. Okay, going back up. Okay, so what happened here? Some of this is kind of like detective work, kind of police examination of the victim. And actually, when there are murders in some places, rather than doing a formal autopsy, some places are moving to using CT scans because they show a lot of the information that you get from an autopsy and much quicker. But this guy is alive, amazingly. And let's see, how is it that he survived? Okay, so here we can see the entries, probably around here. You see some air in the superficial soft tissues. You can't really see that. You can see that there. So it's off this side toward the shoulder, and that's what you're seeing there. And it comes in obliquely here, and then if we look at the bone windows, we'll see the bullet rip through this rib. But before getting there, I think here we are up higher. It smashed through the coracoid process of the scapula. That's a lot of these fragments here. And what do we have here? We have a subclavian artery and the subclavian vein, very close to both of those. Look at this. This is a bullet fragment right here that's right next to the subclavian artery, despite which you don't see any significant hemorrhage. Okay, then it tears through the left upper lobe. What do we see there? Well, it's a combination of pulmonary laceration, which is simply a tear, a rip, a hole, tunnel through the lung. And alongside of that, because of the blast effect, you'll have some contusion. So you rip through the lung, make a hole like that from a bullet, and then there's some bleeding, and that fills in some of this area with an opacity of some extent, and also the blast effect from that rapid travel of the bullet through the lung can give you contusion. Alright, so it crosses over here. It just misses the distal aortic arch. So the proximal descending aorta just beyond the aortic arch is right here. And it just misses that. Very close to, goes right under the left main pulmonary artery. Here's left main pulmonary artery. And you go down, go up rather. I guess it's right over the left main pulmonary artery, superior to it. Misses that, misses the aortic arch, misses the subclavian artery, nails the spine. Nails the spine. It really hits this rib right here, the articulation with the spine, costovertebral junction. And if you look closely in that area, you'll see, well, here's a big bullet fragment there. That's the main part of the bullet. And it's obscuring the visualization of the canal there. But it's not actually in the canal. And it would be hard to window that enough to prove that. But when you have severe, very dense material like lead, which is as dense as it gets, and a big lump of it, you can't really define the margins because of the way CT works. It has all of these pathways of the gamma rays, and it does this interpolation of what densities must be at all of the points along those lines. But because this is so very, very dense, it's outside the realm of normal tissue, and the CT scanner is just not designed to take that into consideration. Okay, so you have this basically what's called beam hardening artifact, and you see the radiations related to that, but the very fact that it looks like there's a bullet right in the canal when in fact there's not. This guy had no neurologic symptoms, so he could have died from a laceration of the subclavian artery, but it missed that. Could easily have died and would have died very quickly if it had hit the descending thoracic aorta. Missed that, went right above the left main pulmonary artery. Still had a fair amount of blood, but he came in, it didn't even have a significant pneumothorax. And that has something to do with the high velocity bullet causing enough bleeding that it kept the lung from collapsing. That's just conjecture on my part. I really don't know. So this is a lucky guy, in a manner of speaking. It's not the kind of luck I would like. Alright, so let's look at the coronals and see how nicely the coronals can display this same kind of information. So we're moving forward here, and let's see what we've got. Here you can see some of the area where the bullet has passed, little pockets of air. And then you move back, and here you see the contusion laceration in the left upper lobe. And you can kind of follow it from front to back. See that? Obliquely through the left upper lobe until you get to the point where the bullet is lodged there, right next to the spine, right here. Remarkable, isn't it, that he got away with no spinal injury? But look at how nicely it can portray that contusion. Let's go backwards. So we're going first the direction of the bullet there. And so you can see a trajectory, you can see contusion around the laceration, little areas of pneumothorax, tiny ones. And you can see just how very close it came to the thoracic aorta. The lung is actually rather small on the left compared to the right. I think you can kind of appreciate that. I'm sure some of that is due to some volume loss in the lung. He's not ventilating it very well, and with all of that pain, people tend to splint and hold their side and try not to ventilate that lung as much. So there you have it. Interesting case.